Today we'll read about audiogram.
Hi, this is Tom from ZeroToFinal.com. In this video, I'm going to be going through audiometry. And you can find written notes on this topic at ZeroToFinals.com/audiometry or in the ear, nose and throat section of the Zero to Finals surgery book. So let's jump straight in. Audiometry involves objectively testing a patient's hearing by playing a variety of tones and volumes. Air conduction is tested by using headphones, and bone conduction is tested using a device called an oscillator that delivers sounds directly to the bones of the skull. Audiometry results are recorded on an audiogram. Audiograms can help identify and differentiate between conductive and sensory neural hearing loss, and we're going to talk in more detail about how this is done. Let's talk about audiograms. Audiograms are charts that document the volume at which patients can hear different tones. The tone is measured as frequency in hertz, which is plotted on the x-axis from low to high pitched. The volume is measured in decibels, which is plotted on the y-axis from loud at the bottom to quiet at the top. The lower down the chart, the higher the decibels and the louder the volume. The higher up the y-axis, the more sensitive the patient's hearing is. Hearing is tested to establish the quietest volume at which a patient can hear each frequency. This level is plotted on the chart. The louder the sound required for the patient to hear, the worse their hearing is, and the lower on the chart they will plot. For example, 1,000 hertz sound will be played at various volumes until the patient can just about hear the sound. If this tone is heard at 15 decibels, a mark is made on the chart where 1,000 hertz meets 15 decibels. If this sound can only be heard at 80 decibels, a mark is made where 1,000 hertz meets 80 decibels. Hearing is tested in both ears separately. Both air and bone conduction are tested independently. The following symbols are used to mark each of these separate measurements. X is used to mark the left-sided air conduction. A square-shaped closed bracket is used to mark left-sided bone conduction. An O is used to mark right-sided air conduction. And a square-shaped open bracket symbol is used to mark right-sided bone conduction. When a patient has normal hearing, all readings will be between 0 and 20 decibels at the top of the chart. In patients with sensory neural hearing loss, both the air and bone conduction readings will be more than 20 decibels, plotted below the 20 decibel line on the chart. This may affect only one side more than the other, or both sides equally. In patients with conductive hearing loss, bone conduction readings will be normal, between 0 and 20 decibels. However, air conduction readings will be greater than 20 decibels, plotted below the 20 decibel line on the chart. In conductive hearing loss, sound can travel through the bone, but is not conducted through air due to pathology along the route into the ear. Both air and bone conduction readings will be more than 20 decibels in patients with mixed hearing loss. However, there will be a difference of more than 15 decibels between the two, with bone conduction better than air conduction, plotted slightly higher on the chart. Thank you for watching this video. If you liked the video, left a comment, or subscribed to the channel, thank you so much. It really helps.
A leader in providing Welcome to Texas Children's Hospital, a leader in providing life-saving pediatric treatments across nationally ranked specialties. Today, we'll talk about the meaning of your child's audiogram. What is an audiogram? During a hearing test, children respond to beep sounds by turning their head, pressing a button, playing a game, or raising their hand. An audiogram shows your child's hearing thresholds at the quietest level that they responded to. All audiograms will look different depending on each person's hearing. Air conduction measures how sounds played through headphones travel to the ear. Air conduction thresholds are represented by shapes on the audiogram. Blue X's and squares represent the left ear. Red circles and triangles represent the right ear. Bone conduction thresholds are sounds played through the skull that travel directly to the inner ear or cochlea. They're represented by brackets and arrows on the audiogram. The lower the markings are on the audiogram, the louder the beeps needed to be for the child to respond to the sound. If the air and bone conduction thresholds are on top of one another, the child hears the same through the headphones and through the bone oscillator, making the hearing loss sensory neural. If all of the markings are in the normal hearing range at the top of the graph, the child can hear all speech sounds with both ears. When the air conduction thresholds are in the moderate hearing loss range, while the bone conduction thresholds are in the normal hearing range, the child has normal hearing at the level of the cochlea, but something's blocking the sound from getting to the healthy cochlea. A child with this audiogram may hear a baby crying, but they may not hear people talking clearly. You can find a copy of your child's audiogram in the desktop version of MyChart, and you can access the written version of the results in the app version of MyChart. You're in the right place. Texas Children's, the difference is life-changing.
In hearing tests, masked and unmasked refer to specific testing techniques used to ensure accurate hearing threshold measurements. Unmasked conduction. This is the standard method used for both air conduction and bone conduction testing and is performed each year individually. Unmasked conduction. This is the standard method used for both air conduction and bone conduction testing and is performed on each year individually. Masked conduction testing. This technique is used when it is necessary to assess one ear's hearing without other picking up the sounds. A masker device generates noise in the non-tested ear to prevent it from hearing test sounds. This ensures that the responses only come from the ear being tested specifically. So we have to remember that a clue here. R for R. That means right ear for red. Right ear for red. R for R. Right ear for red. Red audiogram symbols typically indicate right ear and blue audiogram symbols typically indicate left ear. So R for R. So audiometry is the procedure of hearing test. It is the procedure used to test the hearing. Audiometer is the machine itself. Audiometer is the machine itself. Audiogram is the graphical display of the hearing test. Audiogram is a graphical display of the hearing test. As we see here, we use in the x-axis there will be frequency in hertz, that is the sound frequency in hertz of the sound you play, frequency in hertz of the sound you play, and this is the sound played, and this is the volume in decibels or intensity in decibels which you are going to hear. Intensity of that sound in decibels you are going to hear. For example, if you hear a sound of 500 hertz frequency played at 15 decibels, So R for R. So the symbol for red ear is O for conductive. So this is so you will mark like this. That means this is the frequency of the sound that is played on the x-axis, and the intensity of the sound in decibels which is heard on y-axis. Okay, so this is the frequency in hertz of sound that is played, and intensity in decibels on y-axis which you hear. Frequency of the sound that is played in hertz, and the intensity which of the sound you hear in decibels is on the x-axis. Intensity you hear, whether it's quiet or this volume or intensity you hear is on the y-axis. Next is the symbols. So for the symbols, you have to remember that of color. In the color R for R, you will use red color for right ear and blue color for left ear. R for R. This is how you will remember. Next is for the right ear air conduction unmasked, you will use 0, and for the left ear bone conduction, right ear bone conduction unmasked, you will use open bracket, or lesser than. You can say lesser than. Similarly, for right ear unmasked air conduction triangle, and for the masked is triangle, and for unmasked is the open bracket. Okay, this just represents masked and unmasked is the procedure you used for hearing testing. Masked and unmasked will represent the procedure you use for hearing testing. So how do you remember is, now for the right ear was red, so for the left ear we'll change the color to blue. For the left ear, the marking is air conduction is X. Okay, bone conduction is greater than. This is both for unmasked, but for the masked it will be square and closed square bracket and closed square bracket. So remember that for right ear is right ear, R for R, you will use red color, and always for right ear the brackets are open. Always for right ear the brackets are open in bone conduction. This is open square bracket or open triangle, you can say. Open triangle, you can say. But for the left ear it is for the left ear it will be closed bracket, closed square bracket, or closed you can say closed triangle. Okay, this is for your remembrance and make things easy. This is about the symbols. This is just, don't get about, the common used is the common used test is the unmasked one. So let us remember the symbol for the unmasked. For the left ear we always use blue color and it is X, and this is for the air conduction. For the bone conduction it is left is always closed, so it is closed triangle. Okay, but for the right ear for unmasked is circle and open triangle. Circle for air conduction, open triangle for bone conduction. Okay, let's go now. So air conduction from external ear, middle ear to inner ear. Bone conduction, directly it goes to the inner ear, bypass the middle ear. So see, for the air conduction, the sound will go from external ear to the middle ear, then to the inner ear. But for the bone conduction, it will go directly to the inner ear. It will go directly to the inner ear. Okay, grades of hearing loss. Grades of hearing loss. Normally, air conduction is better than bone conduction. We all know that normally air conduction is better than bone conduction. So, if bone conduction is normal, if bone conduction is normal and air conduction is abnormal, then this is conductive deafness. If bone conduction is normal and air conduction is abnormal, then this is conductive deafness. For example, here, now the bone conduction, now here, the bone conduction, which is represented by open and the closed square brackets, is normal. It is lying within the 20 decibels here. It is lying within the 20 decibels here. That means the bone conduction here is normal. But what has happened to the air conduction? Now we know that the right ear is represented by 0 and the left ear is represented by X. So here we see that the air conduction here is lying between the range of 60 and 70 decibels in both the ears. That means here the bone conduction is better than the air conduction. If the bone conduction is better than the air conduction, it is called conductive hearing loss. Next, if bone conduction is abnormal, and air conduction is abnormal and a narrow gap less than 15 decibels, sensory neural deafness. Okay, let's go to the sensory neural deafness now. So here the air conduction, let's see for the right ear. The air conduction is 0. This is in around the range of 60, between 60 to 70 decibels air conduction. And also the bone conduction for the right ear is open bracket. Okay, open bracket. It is also almost between the between 60 to 70 decibels. That means here there is both bone conduction and air conduction is delayed. Here both bone conduction and air conduction is more than 20 decibels. That means this is sensory hearing loss. And also even if there is a difference, even if there is difference between bone conduction and air conduction and it is less than 15 decibels, even if there is difference between bone conduction and air conduction and it is less than 15 decibels, it is considered as sensory neural hearing loss. If there is difference between air conduction and bone conduction more than 15 decibels, then it is mixed hearing loss, which I will be showing you shortly. Next. If bone conduction is abnormal and air conduction is abnormal and wide gap more than 15 decibels, then it is mixed hearing loss. So okay, this is the slide for mixed hearing loss. This is the slide for mixed hearing loss. You can see that let's take for the right ear now. Again, the conductive, you can say that the air conduction is at 90 decibel, between 80 to 90 decibels for the right ear, between 80 to 90 decibels for the right ear. And also we know that the right ear is open bracket. The open bracket is 40 decibels. That is, the bone conduction is between 40 to 50 decibels. If you subtract 80 minus 40, we are getting a difference of 40. That means this is more than 15. If more than 15 decibels difference between the bone conduction and air conduction, it is called mixed hearing loss. Let's do one in blue for the left ear. Okay, for the left ear here now, the air conduction is between 80 to 90 decibels. Air conduction is between 80 to 90 decibels, and there is a closed bracket is again between 40 to 50 decibels. Again same, 80 minus 40 is 40 decibels. It is more than 15 decibels, then this is mixed hearing loss. So I told you already about the symbols. Symbols: air conduction unmasked. Air conduction unmasked we use for the right ear. For the right ear, circle, and masked is triangle. Then bone conduction unmasked is always, bone conduction is always open bracket for the right ear, and for the left ear it's always closed bracket. Similarly, for the left ear, air conduction unmasked is X, air conduction masked is square. Let's change the color for the left ear, it's always blue. So air conduction unmasked is X, air conduction masked is square, then closed bracket triangle for air conduction unmasked, open bracket, open closed square bracket for air conduction, sorry, bone conduction masked. So bone conduction unmasked, triangle, closed bracket, bone conduction masked is closed square bracket. Okay. So let's take a slide here. Now, this is, now if you see, this is, the color is in blue, and the color is in blue, and this is closed bracket. Now here the bone conduction is between 0 to 10. The bone conduction is between 0 to 10. That means less than 20 decibels. This is normal. But The air conduction of this ear is between 40 to 50 decibels. That is, it is more than 20 decibels. That means this is the air conduction is reduced here. So this is conductive hearing loss. Let's go to the next slide. Again, this is blue means for the left ear. This is represented here for the left ear. Now, what has happened here is, now let's go to the air conduction. Air conduction is at 10 decibels here. Here also 10 decibels. 10 decibels. But as the frequency of the sound is increasing, it is going down. As the frequency of sound is increasing, it is going down. And also you see that the air conduction and bone conduction are almost the same. Both air conduction and bone conduction are almost the same. So this is sensory neural hearing loss. This is sensory neural hearing loss. As the frequency of sound is increasing, it is demonstrating the sensory neural hearing loss in this ear. So the next slide, mixed hearing loss. Mixed hearing loss, we said we should observe for the 15 decibel this difference between the bone conduction and air conduction, and a bone conduction should be better than the air conduction always. Okay, there should be more than 15 decibels difference, and bone conduction should be better than the air conduction. Again, this is for the left ear represented here. So we'll use the color blue. This is a closed triangular bracket, and here the bone conduction is lying between 30 and 40 decibels. It is lying between 30 and 40 decibels. And the air conduction you see is lying between 60 and 50 decibels. Is lying between 60 and 50 decibels. So if we take 50 minus 30 is 20 decibels, it is the difference of more than 15 decibels. If there is difference of more than 15 decibels, then this is mixed hearing loss. So
Hey everyone, today I'm going to show you a basic overview of a hearing test, or what we refer to as an audiogram. When completed, an audiogram is full of information that helps us learn more about your hearing. I'm going to break down each section individually and give a brief description in what that means. This is the test grid. Along the left and the right, you'll see the intensity or loudness of sound. Along the top, you'll see frequencies in which those sounds are presented. Your left ear is represented by an X, usually in blue. Sometimes we use other symbols based on specific situations. Your right ear is represented by a circle, usually done in red. And again, sometimes we'll use other symbols based on the specific situation. These are the different types of degrees of hearing loss, the first being normal hearing. This area would be considered a mild hearing loss. The area in green would be considered a moderate hearing loss. In the small orange area, we have a moderately severe hearing loss. In the burgundy color, we have what we call a severe hearing loss. And finally, in the red, we have profound hearing.
So as per this chart explained here, so the normal hearing, so the normal hearing is between, so the normal hearing is between up to 20 decibels. Up to 20 decibels is the normal hearing. The air conduction and bone conduction should lie within this, and we know that bone conduction is always better than the air conduction. This is normal, but the mild hearing loss is between 20 to 40 decibels. If the child can hear between 20 to 40 decibels, this is mild hearing loss. 40 to 60 decibels. So 20 you can say. 40 to 60 decibels is moderate hearing loss, and 60 to 70 is moderately severe. It is severe, moderately severe, Between 70 to 90, 70 to 90 is severe, and more than 90 is profound. More than 90 is profound. Again, normal is up to 20 decibels. Normal is up to 20 decibels. Mild is between 20 to 40, and moderate is 40 to 60. Moderate is 40 to 60, and 60 to 70 is moderately severe. 70 to 90 is severe. 70 to 90 is severe. More than 90 is profound hearing loss.
More often than not, a hearing loss isn't found solely in one of these zones, unless they have what we call a flat loss. Typically, a loss may start in one zone and go through another, or two, or three zones, or even more. This box is used for your speech test results. These tell us things like what's the quietest you can make out words, and how many words do you catch when the volume is at the level you're comfortable at. After all the testing, we like to put our recommendation. Some tests may be inconclusive, and we need you to follow up with your doctor. Others may need a trial with hearing aids, and we'll guide you through that process. Or we may ask you to come back in a year or so to keep an eye on how your hearing is progressing. So that's just a very brief explanation of what an audiogram is and the basics on how to read and understand one. We'll always discuss this report with you and answer any questions you may have. We recommend everyone over the age of
Again, the same thing what we just now saw, but here they have just written up as per this chart, up to 25 decibels is normal hearing, 25 to 45 is mild hearing loss, 45 to 65 is moderate hearing loss, 65 to 85 is severe hearing loss, and more than 85 is profound. It's just 5 there. There is a difference. Okay. Now, an audiogram is a graph that shows softest sounds a person can hear at different pitches or frequencies. And O is often used to represent responses from right ear, and X is used to represent responses from left ear. There is usually a key on the audiogram similar to one found on map that identifies what different symbol mean. The closer the marks are to the top of the graph, the softer the sounds that can be heard. And audiogram shown above on the left indicates different degrees of hearing loss. This is the degrees of hearing loss. Okay, the pitches shown on the audiogram are those most important for hearing and understanding conversation. Each sound we hear when someone speaks has a different pitch and loudness. For example, yes sound is high in pitch and quiet, and the O sound is low in pitch and louder. The audiogram shown above on the right has shaded area that shows range of pitch and loudness most speech sounds. Range of pitch and loudness more speech sounds. Okay. During the hearing test, sounds are presented in different ways. When testing with earphones or loudspeakers, the sound goes into the ear canal through the middle ear and reach the inner ear. This is known as air conduction testing, and air conduction testing looks how the whole hearing system responds to sound. If air conduction testing shows a hearing loss, another device called bone vibrator is placed behind the ear to send sounds directly to the inner ear. Sounds are sent through the bones of the head and do not pass through the eardrum or the middle ear. This is called bone conduction testing. When something stops sounds from moving through the eardrum and the middle ear, bone conduction hearing levels will be better than the air conduction levels. This means a conductive hearing loss is present when sound moves normally through the outer and the middle ear, but the inner normally through the outer end, but the inner ear does not work normally. Both bone conduction and ear conduction hearing levels will be the same. Sensory neural hearing loss is present. An audiogram shows a severe hearing. Okay, this audiogram is showing now for the right ear. Now for the right ear, the conductive hearing is between 60, 70. It has come up to 90. So here it is between 60 to 70. Above 85 is profound. Above 85 or above 90 is profound. Above 85 or 90 is profound. So this is severe hearing loss. Between 70 to 90. Between 70 to 90 is severe hearing loss. So here we see that it is between 65 to more than 85. 65 to 85, it is severe hearing loss. So the audiogram here shows severe hearing loss. A child with this hearing loss may only hear very much loud speech or loud environmental sounds such as a fire truck siren or door slamming. Click here for example of severe hearing loss. So severe hearing loss, here it is between 65 to 85. It is severe hearing loss. Both almost you are seeing in the same range. Now the audiogram shows moderate high-pitched hearing loss. A child with this hearing loss will have difficulty in hearing regular speech even at close distance. Now here if we see it is between 40 to 50, then 60, between 50 to 60, up to, it has come up to 65. We know that the moderate is between 45 to 65. Moderate is between 45 to 65. But here for the, so this is moderate. Moderate is between 45 to 65. And let's go. This chart, moderate is between 45 to 65. Next. Here this will show mild hearing loss. Here it is showing mild hearing loss. Again, if you take here, it is coming between 20. Most of the readings are coming between, only one reading is here, but most of the readings are coming between 20 and 40. Most of the readings are coming between 20 and 40 or 25 and 45. 25 to 45. So this is mild hearing loss, but as the frequency increases, it has gone up to moderate as well. So mild to moderate, this one. The audiogram shows mild high-pitched hearing loss. The child with this hearing loss will be trouble hearing and understanding soft speech from a distance or speech in background noise. So you can experience what hearing loss sounds like compared to normal hearing. The audiogram, the right shows normal hearing. So here we see that all the readings, both the air conduction and bone conduction is lying below 10 decibels. Up to 20 to 25 decibels is normal. Up to 20 to 25 decibels is normal. To make things easier, we can remember like this. Let's go 20, 20, 20. Okay, I'll show you now. So up 20 to 25 decibels is normal. So between 20 to 40 or 25 to 45 is mild. Then 40 between 40 to 60 or 45 to 65 is moderate. And then between 60 to 80 or 65 to 85 is severe. Anything above 90 or 85 is profound. Anything above 85 and 90 is profound. So audiometry is the procedure, audiometer is the machine, audiogram is the graph. Again, we know all these things will go very fast. Air conduction, red circle and triangle for right ear, and open brackets for the right ear. And let's change the color now. Blue X and square for the left ear, and closed brackets for the left ear, and it is represented in blue color. Next, air conduction from external ear to middle ear to inner ear, but bone conduction will bypass the middle ear. So grades, they are also added one more grade here, super hearing. Super hearing means minus 10 decibels, minus 10 decibels. Again, the same thing we read the grades of hearing: normal 0 to 25, mild 25 to 45, moderate 45 to 65, severe 85, more than 85 is profound. Just go on adding 20, 20, 20. Normally, see, normal is 0 to 25, mild is 25 to 45, moderate is 40, 65, severe is 65 to 50, is 85, and more than 85 is profound. Normally, air conduction is better than bone conduction. Normally, air conduction is better than bone conduction. Normally, air conduction is better than bone conduction. Abnormal air conduction plus normal bone conduction, then this is conduction hearing loss. Abnormal air conduction and abnormal bone conduction, and the gap is less than 15 decibels, sensory neural hearing loss. Abnormal air conduction, abnormal bone conduction, but wide gap is more than 15 decibels is mixed hearing loss. Now again, normal hearing. Now here, normal hearing, this is right ear, which is represented by almost red color, and this is almost 20 decibels. This is within 20 to 25 decibels, so this is normal hearing. Now here, let's draw a line for 20 decibels. This is for the left ear, represented by blue, XX, and triangle is for the so here they have used some other symbols, so let's not get confused. Now here they're using this triangle as the bone conduction. Now let's draw a line here, 50. So between 20 to 40 is mild. So it is almost in 40, 20 to 40. So this is mild. And here the bone conduction is normal, air conduction is mild. So conductive hearing loss present if bone conduction thresholds are normal and air conduction thresholds are raised. Now, sensory neural. Let's go to the sensory neural hearing loss. Here both air conduction and bone conduction are together. For example, this is the right ear. This is the air conduction. Air conduction is between between 40 to 60. 40 to 60 is moderate. 40 to 60 is moderate. Air conduction is moderate. What about the bone conduction? Bone conduction is also between 40 to 60. It is moderate hearing loss by lateral, moderate bilateral sensory neural hearing loss. Sensory neural examination and bone conduction both are raised and less than 15 decibels. Now next, mixed hearing loss. Here, don't get confused with the symbols here. He has used triangle for the bone conduction, which is not used normally. Just we are reading for the sake of understanding only. Now here, what about the air conduction? Air conduction is lying somewhere between 60 to 80. So 20 to 40 is mild, 40 to 60 is moderate. This is severe. There's severe loss in air conduction, but the bone conduction is lying between 40 to 60. Means there is both bone conduction is abnormal and air conduction is also abnormal, but air conduction is bone conduction is better than air conduction, and there is a difference of more than 15 decibels, that is almost 20 decibels. So this is mixed hearing loss. Mixed hearing loss occurs when there is conductive overlay, an additional air-bone gap on top of existing hearing loss. So here pure tones, audiograms, here pure tones at varying frequencies are introduced into the ear onto the head at different intensities to determine the hearing threshold for the patient at each frequency delivered. This is carried out for an air into the ear and bone conduction on the head in turn. Audiogram questions are common and their interpretation is discussed here. Each graph will represent one ear only. Each graph will represent one ear only. Interpreting audiograms. The y-axis always hearing loss in decibels. The x-axis is the frequency of the tones in hertz. The points on the graph represent the intensity threshold at a particular frequency at which I heard the sound. Thus, lower the point on the graph, worse the hearing. There will be a key alongside of graph indicating if point refers to air conduction or bone conduction. Grading hearing loss. Mild is to, let's take 2020. Mild is 20 to 40, 25, 20 to 40 or 25 to 45 decibels. Then 45 to 65 is moderate. 65 to 85 up to 90 is severe. More than 90 is profound. It is important for you to know that sensory neural hearing loss causes a loss of hearing at higher frequencies, and conductive hearing loss produces hearing loss at lower range of frequencies. It is important for you to remember that sensory neural hearing loss causes loss of hearing at higher frequencies, and conductive hearing loss produces hearing loss at lower range frequencies. Also conductive hearing loss does not cause hearing loss usually in excess of 50 to 60 decibels. Also conductive hearing loss does not cause hearing loss usually in excess of 50 to 60 decibels. Remember that when interpreting these audiograms, if there is sensory neural deafness, there will be a parallel drop in conduct hearing loss as well. Remember that when interpreting audiograms, if there is sensory neural deafness, there is a parallel drop in conducting hearing loss as well. This because despite the fact that conducting hearing loss is normal, the sound will not be transmitted beyond middle ear centrally to the auditory cortex. Right conductive hearing loss. You can see that here the bone conduction is below 20, and here there is mild conductive hearing loss for the lower frequencies. For the lower frequencies, as we said that the conductive hearing loss will be there for lower frequencies. Here the hearing loss is seen in air conduction with no effect on bone conduction. The air conduction hearing loss is worse with lower frequencies, as mentioned before, typically characteristic feature of conductive hearing loss. Lower frequencies, the air conduction hearing loss will be worse. Left moderate high frequency sensory neural loss. Here again you can see that in the left ear here, what has happened at the lower frequencies, the bone conduction is almost normal. The lower frequencies bone conduction is now, as the frequencies are going down, the bone conduction is becoming difficult, and even the air conduction. So sensory neural loss usually for the higher frequencies. Here the hearing deficit is seen both in air and bone conduction, as mentioned before. If there is sensory hearing loss, then there will be simultaneous conductive hearing loss on the audiogram. The hearing loss is greatest at the higher frequency, which again corresponds to sensory neural hearing loss. This high frequency type of hearing loss is seen in kernicterus. This high frequency type of hearing loss is seen in kernicterus, birth asphyxia, Alport syndrome, Waardenburg syndrome, congenital rubella, drug toxicity, and meningitis and post-meningitis. What does this show? Profound right sensory neural deafness. Why profound? More than 90 is profound, right? Here it is 70 only. It's above 70. More than 90 is profound. We can say severe. Okay. Next is, this is conductive. How? Sensory. Where is bone conduction is not discussed here. So we are done with audiogram.